The first exercise is a forward step up onto a 6-inch box. The goal is to maintain balance while avoiding valgus knee collapse. Proper technique is stepping up by driving through the foot that is placed on the box. The second exercise is the step up on a whole body vibration platform. This exercise is more challenging for maintaining dynamic knee stability because of the unstable nature of the platform. Vision should be focused on a stationary object. The third level involves the whole body vibration platform and STROBE eyewear. The STROBE eyewear challenges the neuromuscular control for the leg. Combined with the unstable platform, it is difficult to maintain balance when there is a deficit in proprioception. The step up on the whole body vibration platform is more challenging than the 6-inch box, and the whole body vibration platform with the STROBE eyewear results in the most frontal plane deviation. To achieve the best results, these areas need to be addressed in rehab.